welcome to On Air from the International Autoimmune Encephalitis Society. This is a series of video presentations that we're doing that are hosted by IAES, okay? And we usually feature researchers as well as caregivers as well as patients that are involved in the AE community. So if you don't know already, IAES, we intend to provide as much information as possible about AE and support those that are affected by AE, whether you're a caregiver or a patient or even a physician or researcher working in the field of autoimmune encephalitis. So we encourage you to go to the website, autoimmune-encephalitis.org, and take a look. So today, for today's on-air presentation, we have an excellent presentation by Ana Vasconcelos. Tell me again if I have not pronounced your
Yeah,
name correctly. Okay. PhD student from the Center for Neurology and Cell Biology at the University of Coimbra in Portugal. With that introduction, what I'll do is I'll turn it over to Anna and let her explain what she's doing and how you can actually help the AE community by participating in her project. So, Anna, take it away.
Hi, Mitch. Thank you so much for the invitation. It's really a pleasure to be here today and talk a little bit with you about my project, about what we have been doing at GINI, which is our Portuguese association dedicated to autoimmune encephalitis. And it's very nice to give back to your community as well, because you have been helping me so much with our research questionnaires. So it's nice to be here today and talk a little bit about my project and also to appeal to you once again to answer to my final research questionnaires, because I'm now towards the end of my PhD project. So I will go ahead and share my slides. Yes, hopefully you are seeing my slides right now.
Yep.
Yeah. So my project is about co-designing information leaflets about autoimmune encephalitis in a collaborative approach. So with the help of patients, families, healthcare professionals. So the idea is that this collaborative approach is a way to produce information resources that are more tailored for our end users, because we know that sometimes we have information that is very medically and scientifically charged and is a little bit difficult for people that are not into the science or into the clinical terms to understand the information. So that's the work that we have been trying to do. And the collaborative approach, so having the help of patients, families, and clinicians is really important so that we can speak to the audience with the audience. So this kind of collaborative approach, I think it's a very good way to approach this kind of work. So just a little bit about myself before I start with my presentations, just for you to understand why autoimmune encephalitis. So I am currently working as a scientific designer and illustrator, but I have a background in science. So before I moved to science communication and to design applied to health, I was a neurobiology researcher for a couple of years, and I worked in Caspar-2 encephalitis. So I did my master thesis in researching Caspar-2 encephalitis. And so when I changed fields, when I decided that I wanted to be in a different side of science, illustrating and designing about science, I wanted to pursue a PhD in this topic of communicating science through design. And so I decided to keep autoimmune encephalitis. So changing a little bit perspectives and fields, but keeping the topic of autoimmune encephalitis. So just to talk a little bit about the core idea of my PhD project. So the idea is that by using this participatory approach, so working with clinicians, patients, and caregivers, in a participatory approach, we can design infographics, which are visual representations of information that are easier to understand, are more adequate, more engaging, and more related to those directly affected. Does this make sense to try to do this collaborative approach for you?
Yes, yes, very much so. Yeah, because we do run into questions from time to time, and also um, because we have people from so many different backgrounds, and also because Many of our patients and caregivers are not necessarily educated on all the medical terminology and what what things mean when they first hear them, especially if they're new to the AE journey. It's important that they be able to understand it. So this is great work. So
Yeah, the idea is that we also have the voices from people that are diagnosed with this disease, and also to provide some information about their lived experiences, not only about the science or the clinical aspects of autoimmune encephalitis, but also to let them speak about their experiences. And this is why we also included some testimonies in the resources that we did together. So in the beginning of the project, the idea was not to do leaflets or information leaflets. The idea was just to design information for people. So my approach is from the information design side. But this was also that something that was co-created with the people that participated in the project. So the idea in the beginning was to have just general infographics or illustrations. And the idea to design information leaflets was something that was also decided together with the participants because they thought it would be nice to have printed. Of course, we now live in a very virtual and digital way, but it's also nice to have some digital physical copies that people can have. And in the opinions of the clinicians that participated in this project, it is nice to have something physical to have in consultations, in doctor's appointments, to help explain some concepts, for example, about inflammation, about autoimmunity. It's nice to have also something physical so that people can then bring home and try to read again and to bring more questions to the next appointments. For example, we also have a space for notes and questions so that people can write. So although we live in a very digital way, it's also nice to have something physical every now and then. And I think it's helpful to be a tool for clinicians to communicate with
yeah,
patients
very
and
very
families.
much so. Very much so. It's very difficult sometimes to understand what's happening right away, and it's part of that I think is the issue that autoimmune encephalitis looks like a lot of other things, right?
Mhm.
Could be a lot of things, right? When you see the initial symptoms and during the diagnostic process. So it's communication and ways of communicating are important, especially at that point. So
Yeah, exactly. So just a very brief and summarized way to convey what is the main idea of this project is basically just using information design as a way to communicate about autoimmune encephalitis. That's the main straightaway core idea of the project. In this talk, in this conversation, I divided it in two parts. So first, my PhD project, which is, as I told you, about co-designing information leaflets with patients, families, and professionals. And then the second part is the emergence of Genie Association, which is our Portuguese association dedicated to raising awareness, connecting professionals in the context of autoimmune encephalitis. And this is something that I didn't plan to be involved in the beginning of my PhD because this idea didn't exist, or at least it just exists in the head of our president, Dr. Esther Coutinho. But then she connected with our professionals and people that were working in autoimmune encephalitis, like myself, and we together we brought together our common interests of creating this association that was the idea of Dr. Ster, and we created Genie Association, and I've been very much involved in the association throughout my PhD. So starting with the overview of my PhD project, so the first important thing to do was to, before putting hands-on the leaflets, on the infographics, on trying to translate this difficult information in a more clear and accessible way, the first important thing to do was to try to understand the needs of the public. So what was the information about autoimmune encephalitis that was more difficult for patients and families to understand? What were their concerns, what was important for them to understand. And so this is how it started my collaboration with the International Autoimmune Encephalitis Society. At this point in my project, this was more or less in 2023, I reached out to Tabitha and she helped me disseminate the first questionnaires of this project, which were needs assessments, so just to understand the main concerns of this community. about autoimmune encephalitis and their difficulties in understanding and accessing information about this disease. So then after this collection, I started to design the first infographics. I selected the topics that were important to communicate, and I did these first sketches. So the main idea that came from the first part, to understand the needs of the public, was a focus group discussion that I did with clinicians in Portugal. So at this time, it was a little bit difficult to meet with patients in Portugal because I still didn't have the ethical approval to work with hospitals, work with patients. So the first thing I did was to work with clinicians in this project. So we did a focus group discussion, and they told me that it would be a very nice idea to have two different leaflets. One that is called "What is autoimmune encephalitis?" So explaining what is this disease, what is encephalitis, what is autoimmunity, the different treatments that are available in the acute phase. And then a different leaflet called "Living with autoimmune encephalitis." So this was the idea of the participants to have this second leaflet as well, which has more information about returning home, rehabilitation, the process of recovering, basically, and every challenge that is related with this. So this second leaflet we are still developing, and the one that I have prepared and I am evaluating right now is the first leaflet, and I will talk more a little bit about that as well. So after I did this first sketch, after I decided what topics would be represented, it comes the most interesting part, which is the co-design with professionals, the first part, and then the co-design with patients and families. So this was a multi-step process to refine the leaflets from the first just sketch version of the leaflets until the final version that I have now of the first leaflet, of course. So just for you to have an idea of what these first surveys told me, I have just an example of a question that I asked in these questionnaires. In your view, what are the most important things to focus on when making educational materials for people with autoimmune encephalitis and their caregivers? I have selected here three quotes that highlight the importance of visuals, of designing clear and accessible information tailored to this specific audience, which we know that people that are affected by autoimmune encephalitis, they can have consequences like brain lesions, cognitive impairments, and we need to take into account when we are designing with and for these people. So this is just for you to see how the first version looked like. So it was just a very simple draft leaflet with space for people to give their comments. These are yellow pages were just questions and prompts that people had in this stage. This was the first part, so it was the co-design with the clinicians. And so they had these yellow pages here in which they could give their opinions so that I could then analyze this feedback and refine into the next versions of the leaflets. So the idea of having this as a draft is that in co-design sessions it's very difficult to arrive with a blank canvas or with a blank page because people have lots of ideas. Some people are not very comfortable in drawing, for example, because they are afraid they are not skilled at drawing. And so it's very difficult to just bring a white page to a co-design session. So it's nice to have something there, to just have some ideas, but to have it more or less looking like everything can still change. So people are not reluctant to give their opinions and to want to change things. So it's nice to have this sort of compromise between having something that looks finished, but also don't bring just a white page because it's then very difficult to start conversations in co-design sessions. And this is what I tried to do in these first sessions.
Okay, then was that aspect where you needed to present the survey and sort of get the feedback form in a sort of a condition that didn't look completely polished? How did that thought come about? Did you get, I mean, was that a conscious decision on your part, or was it more like just a general idea that you had?
Of what? Sorry, I think I didn't understand the first part.
The question I have is like, how did you decide to present the material in sort of a pre-publication format versus something that was maybe looking a little more
Ah,
finished and polished?
yes. Well, I'm supervised by three people, three researchers that I have some experience, especially one of them has some experience in co-design sessions. She's working in co-designing materials with people with dementia. So she
No.
had already some experience in researching co-design and doing these participatory approaches with patients and families. So my initial idea was that I am co-designing everything with everyone, but then she told me that could be a challenge. So it's especially if you are working in the first stage. I was working with clinicians and I was meeting them when they had the time because we know clinicians have lots and lots to do. It's difficult sometimes to meet with them. But what she told me was to try to already have some drafts, something that we can have a basis of discussion and that we can improve from there.
Okay,
And
good.
so, yeah, it's definitely a challenge to just arrive in a white, although it could bring some nice results to just arrive with a blank canvas, but that would be more time consuming for the first part because if I just have an hour to work with clinicians, it's very difficult to, at the end of an hour, have something there.
Yes.
So it's nice to have something as a basis of discussion.
Very good. Yes, thank you.
And so here in these photos, you can see this is the last co-design session that I had with professionals. This was on site. So they were mainly neurologists and psychiatrists, and they worked in groups to discuss and suggest alterations in the leaflet. So here, the leaflet was a little bit more evolved from what I showed previously. But they could still give me nice feedback. And after these sessions, I would analyze the feedback and then inform the next refinement of the next steps. And then arrived the stage in which I worked with patients and families. I worked with 7 people. All this work was online because we had people from all over the country. And although our country, Portugal, is not very big, it's very difficult sometimes for people to meet together for these co-design sessions. And so we meet online with 7 participants that all of them are already after the acute phase of autoimmune encephalitis. So they are already at home, they already are recovering. Some of them have consequences, but they were able to participate in these sessions. So we discussed about the accessibility of the text and the illustrations. They suggested new themes, for example, about disease prognosis. So the question that they ask doctors is my wife, is my daughter, is my mother going to be okay? And this is uh, something, as you know, very difficult to answer for professionals because they don't know. In the beginning of the disease, they can't answer to questions that are very difficult like that. But in these sessions, what these patients and families told me was that it is better to have something there to just address this issue of prognosis than to leave it unmentioned. So it's better to just say that clinicians in an initial stage, they can't answer if the person is going to be okay because there's a lot of things that still can happen in the course of the disease. Some people get well very fast, or it really depends, and every patient is different. But what they told me is that it is better to have something there. And I will show you in the leaflet, when I show the final leaflet, I will show you how we addressed this question of prognosis. They also discussed the importance of having personal stories. So testimonies, they told me that if they were diagnosed at this moment, they were already recovered, but if they were going to be diagnosed, it would be very important for them to have some testimonies of people that gone through this experience, and they provided those testimonies, those patient stories to include in the leaflet. So this is where I am at currently with this project. I have now this leaflet, the first leaflet produced, and I have been reaching out to societies like yours to share the feedback questionnaire so that I can hopefully improve this version. So depending on the answers that I have in the questionnaires, the idea is that I improve this final leaflet, or if it's okay like this, I produce it more and distribute it in the websites digitally. So all of the collaborators that I have been having to help me disseminate the leaflet so that it can be used by clinicians in the hospitals, and then so that patients and families can freely access the leaflet. So I have also been sharing the printed versions in Portuguese hospitals. So I have this leaflet in Portuguese and in English, and so the idea is that clinicians can use them in newly diagnosed patients and families.
Very good. So, I guess you may be going into this now, but what's the acceptance and response has been so far?
Yeah, I thank you. Thanks to societies like the International Autoimmune Encephalitis Society, I have been having very nice responses. I'm around 50 responses for patients and families, a little bit less for clinicians, but I still need to target the dissemination of these leaflets, and I'm counting on you, our audience, to help me with this as well. So what is the goal of these leaflets, of this questionnaire? Sorry. The idea is to understand if the leaflets are effective, so if they are relatable, if they are understandable, if they are adequate, if they are engaging. So basically, if they more or less answer to the questions and concerns that people have when they are diagnosed. We know there are a lot of questions and concerns, but hopefully what we are trying to see if this is a good tool to answer to some of those questions. If it's understandable, that's more or less self-explanatory, adequate. So if they feel like the text and illustrations are appropriate and they are relevant and engaging. So if they are interested in keep reading the leaflet, if they don't get tired in reading the leaflet. So if our audience, if you subscribe to the International Autoimmune Encephalitis Society newsletter, you probably already came across with the ad for the questionnaires. And the idea so is that if you didn't answer to the survey, if you are available to do it, of course, it's your own choice, it's your voluntary participation. We would be happy to have your participation in the questionnaires that are still open until the end of March 2026, maybe more or less that period. It depends a little bit on the engagement in the questionnaires, but I have here the QR codes for the surveys. The surveys are for patients and families, and I also have another for healthcare professionals. And what I want to ask you is that if you are watching our recording, you can pause here the video and go to the surveys. And because I'm showing you now surveys and asking you to stop the recording and come back later, is because in the surveys for patients and families, the idea is that people answer to some questions before they see the full leaflet to more or less evaluate if the leaflet is understandable. So that topic that I told you before, that criteria of effectiveness that I showed you before, because I have some questions before and then some other questions that I repeat after people see the leaflet so that I can evaluate that part. But after you answer to these research surveys, you can come back to our recording because I want to now show you what the leaflet is looking like. I have here some digital version of the leaflet. And so the idea of the leaflet, as I told you, was to bring some information that is most relevant when people are diagnosed with this disease, and especially when this is acute stage and if people are in the hospital, hospitalized. The idea is to be a tool to explain also to caregivers, to families, what is happening. So I have here some information about what is encephalitis, also about autoimmunity. So this idea of having a defense police cell is to explain more or less what happens in our immune system that recognizes virus as foreign and targets the virus when we have healthy immunity. But when we have an autoimmune disease, or in this case, autoimmune encephalitis, we have our immune system, in this case, personalized as a defense police cell to attack our own body. So that's not supposed to happen, and it happens in autoimmune diseases like autoimmune encephalitis. We also talk about what specifically is autoimmune encephalitis. Oh, sorry, just to go back a little bit. And we talk a little bit about different types of antigens that are targeted by autoantibodies, and that gives the different subtypes of autoimmune encephalitis. We talk about how autoimmune encephalitis develop, and we make the comparison between a healthy brain that has normal neuronal components that make the brain work and function normally, but then we can have proteins. In this case, they are considered antigens, and they are targeted by our immune system. And that triggers inflammation and can cause the neurons to function improperly, which is the case of autoimmune encephalitis. So we have here more or less the comparison between the two scenarios. Sorry, let's move on. We also have a little bit of an explanation about the causes. This is a question that patients find really important for them to understand, because they ask a lot, why is this happening? Why is this happening to me? So, of course, we know that most of the cases, or at least more or less half of the cases, we don't know. It is of idiopathic cause, but there's other cases that we can explain more or less the mechanism or what is behind autoimmune encephalitis after an infection, or when it's associated with tumors. So we have more or less an explanation of that as well. The symptoms. So this was also very difficult to convey, because we know that every patient is a different patient, and there's a large spectrum of symptoms associated with autoimmune encephalitis. So it was very difficult to put all of them in here, but we tried to come up with this idea of making the symptoms that are in larger text are the most common ones, and the ones that are shown in smaller text are the less common. So, for example, in a practical example, if a clinician is using this with a patient or with a family member in the hospital, they can put a circle around the symptoms that are relevant to this family and ignore the others. So it can be more or less used as a tool to people to write down, to make annotations on the leaflet. It's supposed to be something like this, or people can use it as the way they like, but you can use it like that as well. We have also here some the diagnostic texts that can be done. The most common ones, of course, how it is treated, the most common treatments, and here is what I wanted to show about the prognosis. And the question, how can autoimmune encephalitis progress? Because we know that each case is unique. So we made here more or less a conversation between a mother and the clinician, and she's telling the mother exactly that each case is unique, that treatment is available. Recovery usually happens when the treatment is done as soon as possible. But it is a conversation that, as I told you before, and as you know, it's difficult to answer to the question. But in this scenario of a mother speaking to a clinician, we can more or less target that question that arises in patients and families' minds about what is going to happen. And of course, we cannot answer straight away to the question, but we have more or less here this dialogue that addresses this question, and that the clinician says that we are here to support your daughter throughout this journey. So to try to address this question of disease progression. And we also have here some patients' testimonies. We have here the full testimonies of the people that participated in the co-design sessions, and they were available. They were available to give their own testimonies about autoimmune encephalitis. And then we have here some space for useful contacts. Of course, this is the most basic information about autoimmune encephalitis. This is the most important things to convey, but then we have here the contacts for other organizations if people want to find more about autoimmune encephalitis. It's a challenge for our Portuguese audience because I did this work in the Portuguese context because a lot of people they don't understand English that well. A lot of people do, but some people have difficulties in English, of course, because it's not our main language. So if people are comfortable with English, there's a lot of information in an organization like yours with other organizations that talk in a very accessible way about autoimmune encephalitis. And hopefully in our association, Genie, we also will have more information, more detailed information about this disease. And then we have space for notes and questions. And here at the end, I acknowledge the people that participated in this co-design approach, not only the healthcare professionals, but also the patients and families that helped me come together with these leaflets. And then at the end, the logos of all the partners that helped in this process, in this project. Okay, I will now move to the second part talking about Genie, but if you want to ask some questions of what I showed before, feel free.
Yeah, well, this is very good, and what we're I think just to kind of pause for a second and say, remind people that are viewing, the presentation that what we're doing is asking for feedback on these materials, and your feedback will help kind of refine it and
Mhm.
make it so that it's applicable across the AE community. And so what you're doing is you're really helping others that have AE. And what we're hearing more and more, especially the part where, post-diagnosis, and we get into prognosis and getting to the point where we're saying, well, am I going to get better? How long is it going to take? Is my daughter going to be okay? Is my son going to be okay? Um, that's probably the biggest pile of unknowns
Mhm.
for AE patients. So, kind of knowing that that journey is going to be a journey, and that but you have help during that journey is going to be really important. So, anything you can do to help with refining this messaging, it'd be great. So, I encourage people to go to the IAES website, look for the survey. Also, if you clicked on those barcodes earlier in the presentation, just use those. So, okay, now we're on to Jeannie. Okay.
Thank you so much, Mitch, for your final appeal to my service. It's really important to gather these opinions and to refine the leaflet. So then moving on to Genie. So Genie is the group of studies in neuroimmunology and encephalitis, which is very recently, just about 2 weeks now, a nonprofit association. So before we were a group, an informal group of people with this goal of raising awareness about autoimmune encephalitis and other immune-mediated neurological conditions. And now we are a nonprofit association. And as I told you before, the idea of creating this group comes from Dr. Esther Coutinho, which is a neurologist and also a researcher, and now the president of Gini. So Dr. Esther and I, we work at the same institute, the Center for Neuroscience and Cell Biology at the University of Coimbra. And when we met, she already knew my interests in autoimmune encephalitis and creating health literacy in autoimmune encephalitis through information design and through designing more accessible information for patients and families. So she reached out to me and to our science communication office, where I'm based at CNC. And so we and other colleagues, mainly scientists working in AE, other neurologists, we came together to create and establish this association, this group of people to raise awareness, connect professionals, and support patients and families in Portugal because it's a real need to create this in Portugal. Because, of course, as I told you, there's lots of information about autoimmune encephalitis online, but most of them it's in English and it's not accessible to everyone in Portugal. So it's important to have more tailored information in Portuguese to help patients and families and to create health literacy about autoimmune encephalitis in the Portuguese society. So these are some activities that we did so far in Genie. We had our first meeting, you can see here, just a year ago. This was an informal meeting between us, just professionals, because at the time we didn't have our association yet established as a nonprofit, but now we are. And we had our second meeting just last Thursday, already with participation of professionals, patients, and families. So besides our meetings, we have also been collaborating with other international associations like yours, like Encephalitis International. So we've been very much trying to connect as much as possible with other societies, with other associations, so that we can learn from each other, share experiences, and that we, Genie, can grow as well. So we also celebrated the World Encephalitis Day, which is almost as well around the corner this year. And so that's the idea of Genie, to grow, to involve more, engage and involve more patients and families to raise awareness about autoimmune encephalitis in Portugal. Just to show you a little bit our website, we have information in Portuguese for patients and families. We have here a section dedicated to patients and caregivers, professionals and other resources, which is more like visual contents, audiovisual contents. There's a lot of information here in the website that is still growing, so it's still in an early stage of the website. But if you are curious, if you are Portuguese speaking, of course, this is all in Portuguese, but if you are just curious to see our work, you are more than welcome to go to encephalitis.pt and explore a little bit our websites. I can show you the rest of it, just the initial page. We have here some publications. So we worked with a company that uses AI to filter the most relevant scientific articles about autoimmune encephalitis. So we have a section dedicated to research where it filters the most relevant papers about autoimmune encephalitis. Of course, this is maybe a little bit more tailored to clinicians or to professionals, but people that are interested in the research and that can they are more interested in finding more research, they can go as well to this section of the website to know the most recent research. We also have a section dedicated to news, projects that we are doing at Genie. And yeah, that's the main page. So if you are interested, you can go to encephalitis.pt and explore a little bit our website. So these are some photos of our last meeting, last Thursday. So it's really, it was just last week. And so in our meeting, we had talks from experts in autoimmune encephalitis, both national and international. So in the morning, this meeting was in English because we had invited keynote speakers, international keynote speakers, because it's also very relevant to professionals that work in Portugal to know more about research that is done worldwide. But then in the afternoon, our sessions were all in Portuguese to be as accessible as possible to everyone. And we also had the participation of around 10 patients and families that join us in our meeting. So we have here Dr. Esther Coutinho talking with our audience about the research that has been done in autoimmune encephalitis. We also had personal testimonies. So we had a session dedicated to personal testimonies, and we had 2 patients and 1 caregiver, a mother of a child with autoimmune encephalitis, talking about the experience of the journey throughout autoimmune encephalitis. And we also did a focus group discussion. A focus group discussion about the leaflets, the information leaflets. And this is why, Mitch, I wanted to postpone a little bit our conversation, because I wanted to talk a little bit about what happened in the conversation. And I'm glad I did, because it was very interesting and very eye-opening to see what happened during this discussion. So what happened is that it was the first time that most of the participants in this meeting, and particularly in the session, almost every participant, every patient and family that went to the meeting then participated in this session. And it was very interesting to see that it was, for most of these people, it was the first time that they were meeting someone who had gone through a similar experience with autoimmune encephalitis. So they immediately, in this conversation, I explained the purpose of the conversation of discussing the leaflets and for them to give opinion about the leaflets. And so they immediately started to share their experience, to ask questions between each other, to ask about the experience of others, sort of like a support group. And we ended up not discussing the leaflets at all, which was completely fine because it really revealed that it was important for these people to come together and have a space to connect and share experiences. So it revealed something that it's very important and urgent in the Portuguese community. And this is something that we really want to address and make more efforts to address in Gini, is to create a support group for people that are diagnosed with autoimmune encephalitis and their families, to connect, to share experiences, to ask for help. Um, and I was not surprised that this happened because we knew the scenario in Portugal, that we didn't have so far an association that connected with these patients. And so for me, it was very important. Although I didn't get the results from the leaflets themselves, it was still very important for me to do this group and to allow people to just connect with each other, because some of them came from different parts of the country to be at this meeting. So of course we need to respect what people want to talk about together. So it's really important, and uh, we are now at Gini trying to. We're really motivated after this meeting to address more the support group for patients and families.
Very good.
Do you have anything you want to ask from these parts before?
Well, yeah, I guess you mentioned that once you get AE patients and caregivers together, that's you're right. It doesn't happen very often.
Yeah.
There needs to be a place where they can go gather in their language, and go see it. We see at IAES, we have a moderated support group, and that can get the discussions there can get quite vigorous sometimes about treatments and what works for you and what works for me, and we do moderate those discussions. But having access to others in AE is so important, because you're searching for information, and you're searching for all possibilities, and just getting feedback on your say you're getting treated with IVIG, and you have this kind of response, or you have this kind of reaction or whatever, or non-reaction,
Mhm.
getting a sense of whether your situation is typical or atypical or not gives you a lot of information that you can take back to your physicians, and ask the right questions. So, our hats are off to you for doing this. This is good. So
Yeah, that was something that we also want to value in Gini. Not only, as I told you before, the medical, scientific knowledge, but also the lived experience of people. And I think it's important to have this group so that people can share what is happening to them, to ask questions for others that live through similar experience. And so the conversation then just went so fluid, I almost didn't say anything because it really revealed the necessity of people to connect and to share experiences. And I was happy that at least it was something that people felt good participating in. Although it is very emotional, of course, because some people were telling their stories, but I think most of the participants, they were happy that they participated in a group like this. So
good.
okay, so just to discuss the next steps for my project and for Gini. So for my project, I will analyze the questionnaires and share more widely the leaflets. So that's why I'm not sharing the leaflets as widely, because I'm trying to first evaluate. And as I told you, because I have questions before and after people seeing the leaflet. But after I close the questionnaires, I will try to share the leaflets as much as possible with our collaborators like you. I'm also working on the second leaflet, Living with Autoimmune Encephalitis, which brings lots more challenges. Here I will talk about recovery, rehabilitation, also social support, and this is very different. I think this one is a little bit more difficult to be worldwide because, of course, the clinical aspects are more or less worldwide, but here in this case, when I talk about social support, it's a little bit different from country to country. But still, I will try to do something that still can be at least some topics that can be translated and used worldwide. And for Jeannie, we want, as I told you, it was really eye-opening in this meeting, and we got inspired in this meeting to support and engage more patients and families in our association, and of course, to collaborate more with international organizations to have your help, share experiences. I think that's also very important. Uh, to finish, of course, if you are curious, if you are Portuguese speaking, well, it's more appropriate for people that understand or speak Portuguese. But if you are curious in general, you can follow and reach out to us in our social media. You can find the QR codes here and our email, our websites. We are very young, but we want to grow as an association. So we want to have as much help and people engaged as possible. And so that's our goal and our mission. Before I finish my presentation, I couldn't finish without thanking all of the collaborators that have been making this project possible, especially the people that volunteered their free time to participate in the project, not only in the co-design sessions, but also in the surveys. So this is for our International Autoimmune Encephalitis Society audience as well. Thank you for all of you that answered to the surveys, and thank you for listening, basically. I finish with, once again, the appeal. If you want to participate in the surveys, they are still open. And thank you so much.
All right. Well, you're welcome, and thank you for your efforts on the behalf of the AE community and IAES. We all need to just keep doing what we can to help people understand and get as much help as possible, and make it easy to get help and get it. And most of that help is actually in the form of information that we get. So encourage everyone watching today to be sure you go to the survey. In general, if you're not familiar with IAES, it's autoimmune encephalitis dash, autoimmune-encephalitis.org, autoimmune-encephalitis.org. Go to our website. There you can see the survey and participate in the survey as well. But also, if you're new to the AE community, you can go there and get all kinds of information that will help you through your journey, all the way from diagnosis, through recovery, and not only patient-centered information, but also information about caregivers. The last thing I wanted to remind people of was the month of February is AE Awareness Month, and that whole month through IAES, we're going to have a series of speakers, webinars, live webinars that you can either see it live or you can see the recording. So be on the lookout for that. So thanks again to the audience. If you're so motivated and so moved, we always accept donations from folks to help support our efforts. So please consider that. And then with that, I think we'll end our session for today. So thank you very much, Anna, and thanks everyone for watching.
Thank you.